Welcome back to the EPRS Chronicles. This is episode 2 in our 3-part series on care work. In episode 1, we focused on unpaid care work, which is usually invisible and falls overwhelmingly on women taking care of members of their own family. In episode 2, we will look more specifically at paid care work. For this, I'm joined by Cecilia Navarra, policy analyst at the EPRS. Hello and welcome, Cecilia.
Thank you, Kelly.
So tell us, what is paid care work?
Well, this is work done by professional carers. And professional carers are workers responding to the care needs that you discussed about in the first episode, such as childcare workers and teachers' aides, or personal care workers in the health sector. The definition can vary a lot, actually. And for example, the broad definition used by the International Labour Organization includes education, health, social work, and domestic helpers. A narrower definitions includes mainly workers involved in childcare and long-term care. And they can both work in homes or in institutions, for example, in residential settings.
And what is the current status of paid care work across the EU?
Well, first of all, it's not enough. So the need for care work, including paid care work, will only continue to rise. We know that we are an aging continent. And currently, only about 30% of the elderly people in need receive long-term care, actually. Those who provide care work suffer very often of poor working conditions. So they are more likely to be among the lowest wage earners, to work part-time, to have temporary contracts, and to work non-standard hours. And also in terms of access to social security, this is often inadequate. So the EU Court of Justice recently had to intervene against the exclusion of domestic workers from social security benefits. So to put it mildly, we could say that these conditions have the effect that the sector is not attractive.
Well, considering we have an aging population, this seems a little bit alarming. Can you tell us how we got to the point of it being so unattractive to work in care work?
Sure. This is in large part the result of applying a low investment approach to the care sector at the expenses of both workers and care recipients. The second problem is what I would say restricted access and low affordability of care services that reinforce what we have discussed in the first episode, so the gender task of unpaid care work at home. And the third problem is often a low quality of care services, also due to strong cost-cutting and outsourcing of care services, sometimes with limitations in monitoring and in oversight.
And do we know how many people work in the paid care sector across the EU?
Well, it is not easy to identify exactly because it's a work that lacks full recognition as a profession that itself indicates that it's still undervalued. We estimate that there are approximately 12 million care workers in the EU, paid care workers, and this is based on the calculations of the European Institute on Gender Equality, who has done extensive work on this topic. But in this calculation, we also include an estimate of undeclared work. So the care sector has a much higher share of undeclared work than the average economy, and the European Labour Authority is trying to quantify it. This is especially strong in home settings where undeclared work can get to 53%. And this does not take into account underdeclared work, meaning when, for example, a person works 12 hours but only 8 are declared. So for undeclared workers, vulnerabilities are even stronger than the one that I mentioned before in terms of lack of social security and lack of legal protections, just as examples.
We saw in episode 1 that unpaid care work is more likely to fall to women rather than men. I think I know the answer to this question, but let me ask you, who is likely to do more of the paid care work and why?
Well, women again, as you probably imagined. So almost 11 out of the 12 million of paid care workers we counted are women. And about 1 out of 4 care workers has a migrant background.
And what do you think determines who is more likely to take up these jobs, including people from a migrant background?
Well, currently we can say that the care sector is risking reproducing and amplifying existing inequalities in society. Care workers often face different layers of discrimination. For example, we see that about 8% of care workers are migrant women working in an undeclared situation, who are at greater risk of exploitation. So indeed, together with gender inequalities, the sector also reproduces class inequalities, since more affluent households are employing more vulnerable social groups. So an important part of this workforce, it's interesting to point out, are intra-EU mobile women workers. This move is often from East to Western Europe. And for example, a recent report estimates that up to 98% of live-in elderly care workers in Austria are migrants, mostly from Slovakia and Romania.
Taking all this into account, what can be done to improve working conditions for all those who work in the paid care sector?
Well, public policies, both at national and EU level, can do a lot to improve working conditions for care workers, and at the same time to guarantee access to quality care to all the people in need. The most important thing, I would say, is to take out care work from the shroud of invisibility. This can be done through, for example, policies on proper recognition of professional qualifications and investment in carer skills, as well as improved working conditions in the sector, by improving collective bargaining and guaranteeing social rights to care workers, through, for example, a gender-neutral job classifications that does not systematically disadvantage women in wage setting. And all of this could translate into improved wages and overall improved working conditions.
Thank you very much, Cecilia.
Thank you.
In our next and final episode, we will discuss the positive impact policy change could have for paid and unpaid care work across economy and society in general.